So what's the difference between a permanent toenail removal and a temporary nail removal? So I'm going to demonstrate that in this video. We're removing a toenail on this patient's right foot. That is going to be a temporary procedure, and then we're going to do a permanent procedure on the other toe. And the difference in these, one's called a toenail avulsion meaning we're just removing it, and the other is called a matrixectomy, and that's where we're introducing a chemical called phenol to stop the toenail from growing back, and it's done by ablating the cells that grow the toenail. So you can see here on the right foot, this patient has a somewhat damaged great toenail, and the plan is to remove the toenail and then let a new nail grow in. And then as that new nail is growing in, we're going to treat it with a agent called ketoconazole. It's actually a topical cream. It's an antifungal cream, ketoconazole, and they're going to apply it twice a day for up to 6 to 9 months. It takes that long for a toenail to grow back. And there's no guarantee that this will completely clear the toenail. But this is one option, especially an option for patients who have failed oral antifungal treatment. There's a pill called Lamisil or terbinafine that we use to treat fungal toenails, and we'll prescribe that over a 4-month period. It's a pulse dose where the patients will take 2 pills once a day for 7 days, and then they stop it for 3 weeks, and then they resume it again twice a day for a week, and they'll do this for 4 months. It's pulse dosing Lamisil, and that is if we don't remove the toenail, but there are instances where we'll try doing both. In this particular patient, they have failed oral Lamisil, and the plan now is to do a nail avulsion on this patient's right toe and treat the nail bed with ketoconazole as it's growing back, with the hope that the new nail that grows in will be clear. And again, there's no guarantees, but this is kind of a last resort for patients that want to try and clear their toenail of any deformity, or you can call it fungus, but it could have been a trauma that caused this. We're going to treat it for fungus anyway and see if we can get it to clear. And again, it takes about 6 to 9 months for a toenail to grow back. And they'll treat it with that cream as well as covering it with a Band-Aid and Neosporin for the first 2 weeks. Sometimes instead of the Neosporin, they'll just use the ketoconazole with a Band-Aid. So we moved over to the left foot here, and you can see this is the left great toenail where they have a similar problem, but this one has failed everything imaginable. They did know that they traumatized this toenail. They had dropped something on the toe which created a deformed toenail, and it's come off several times, and it continues to grow back this way. And when that happens, most of the time I'll recommend what's called the matrixectomy, and that's where we're introducing a chemical to burn the cells that grow the toenail. So that's what we're going to be doing here. You can see the nail is removed in the same process that we did a nail avulsion. And we'll remove any of the hyperkeratotic or thick tissue that's left behind under this toenail, because remember, the toe or the skin is used to being in contact with a thin toenail, and when that nail becomes severely thickened, it rubs against the shoe, creates more pressure, which can create callus tissue and thick tissue that you can see that we're removing here. And if we don't clean that out, when we put the chemical on that you can see that we're introducing here with this cotton-tipped applicator, if we don't clear out all that thick hyperkeratotic or callus tissue, we aren't ensuring that we're getting this chemical into the nail matrix. And we want to make sure that we do that so that we can ablate enough of the cells to make sure that it doesn't grow back. So that's what we're doing here. And we typically will do 3 30-second applications or close to that. It doesn't have to be exactly 30 seconds, but you're trying to keep this chemical in contact with the nail bed. Some surgeons will do 2 45-second applications. I generally do around 3 30-second applications. In this video, this could be shortened due to editing, where you may not see the entire application. So this creates a burn, and the way that the patient is going to treat this after the procedure is soaking it in warm water and Epsom salts, or they can also use warm water and antibacterial soap. And they will do this twice a day for about 2 weeks. And then after that 2-week period, there may be a little bit of a burn that remains, but at that point, they can stop doing the soaks. The soak is mainly indicated to facilitate drainage and keep that nail bed clean, because when they shower or bathe, it can sometimes be sensitive and painful, and they don't like scrubbing it. So if they soak it, that helps to reduce the pain, and it ensures that it's draining and staying clean. So what does the toe look like after this procedure? Well, you'll have a clean, healthy nail bed, and that nail bed will look like the adjacent skin. That's the goal. It will not be sensitive. You don't need the toenail to protect any of the underlying bone to the great toe. Some people think the nail is a protective agent, and it kind of is, but you don't have to be worried about that when you have the toenail removed. Some patients will the female patients can paint the skin to simulate like a toenail is there if they've painted the remaining toenails on that foot. A complication that we'll sometimes see is if nail spicules grow back or tiny borders. If we don't get into the nail grooves, you'll sometimes see portions of cells that will reoccur. So hopefully we'll get a clear toenail on this patient's right foot, and that's how we're treating the left side with the matrixectomy. If you have any questions about these procedures, you can drop them in the comments section below. If there's any other surgeries you'd like to see, please let me know as well.